This is Rebuttl, presented by Extra Insights.
Hello and welcome. My name is Vikram Pratap Singh, and this is Rebuttl, presented by Extra Insights. Rebuttal is a civilized debate on issues that matter for curious news consumers. With the number of new daily cases decreasing, has India reached its COVID peak? Festivities around the country are still being celebrated, but with caution. What should be India's next steps? Not just to decrease its number of deaths, but also to kickstart the economy. This brings us to the topic of today's debate. Has India reached its COVID-19 peak? Let me quickly establish the rules. Each participant gets a total of 5 minutes for opening comments, 3 minutes to rebuttal and refute, and 1 minute to share their closing comments. Speaking first and for the motion is a CRY volunteer, a research assistant, and a national level debater, Samir Ghugre. Speaking against the motion is Hamed Aziz Safwi, a student of St. Xavier's College and winner of several national and international debate contests. Samir, the mic is all yours.
So, what first I want to lay down is a couple of historical, like the historical context which matters, right? Because this is not the first pandemic that, as a planet, we have faced, right? We had one of the most deadliest pandemics, which was the Spanish flu in 1918, and followed by the Hong Kong flu in 1968, right? So, in both of these cases, the pandemic lasted roughly about 2 years, and for the Hong Kong flu, it was about a year and a half, and they had a death toll which was in the millions. I believe the Spanish flu being the deadliest, with around 3 to 4 million casualties globally. Now, when you look at that and you look at what's going on today in the world of COVID, you clearly realize that it's drastically less, right? But now you can often attribute that to the great advances that we made in healthcare. And this is one of the reasons like COVID hasn't been as deadly as its influencer brothers, right? But there has to be one thing which needs to be kept, like especially in mind, is that the costs that come with dealing with a pandemic. So so this is one place where I do want to highlight a country like Sweden, right? Uh, on the outbreak of the pandemic, especially when it spread to Europe, Sweden's governmental policy concerning the lockdowns was something bit of a unique, right? It got a lot of flack from obviously its European relatives as well as other established institutions, with the New York Times calling it a rather deadly misstep. But surprisingly, this policy that Sweden followed was that it did not enforce government mandated lockdowns, specifically when it came to business houses. Rather, it decided to let its citizens have a free reign and only limited the number of people at a certain social gathering. That was the primary standout that Sweden took. Now, it's any policymaker would tell you that it's clearly not fair to compare and contrast policies when you're looking at two countries with absolutely different geographic, demographic, political, like sort of markers. Right? But the important point we have to understand isn't like a developing country like India, right? One of the main reasons a pandemic can be so deadly is the fact that if its ability to induce a depression, right? When you look at the 1918 Spanish flu, it was a primary factor which led to the Great Depression of the US, which continued into the 20s, right? The governmental policies were one of the primary reasons that industries had to be shut down in that region, which led to one of the worst depressions that the US ever known, right? So now let's have a look at what exactly is going on right now. So the peak in India for the COVID cases was reached at around very close to a lakh a day, right? Today, roughly it's dropped down to around 60,000, right? And this is what we've heard of the idea of so-called the flattening the curve, right? Now, a very common misconception that exists is as to what the meaning of the word flattening the curve is, right? The flattening of a curve never ever meant what the defeating of the disease, right? That we completely see zero new cases, there'll be a zero incidence of disease anywhere, right? So the primary idea behind flattening of the curve was always to allow the health sector, right? Your hospitals, your entire structural health system that you set up in the country to be able to combat the cases, right? So that whenever healthcare was needed to be given to a certain person, it would be available, right? So when you're looking at from at it from a country's perspective, the fact is that if your healthcare system is completely overwhelmed by, let's say, a lakh of cases a day, that's never going to happen, right? And you're going to have such high incidence of cases and deaths that every single day there's going to be an absolute disaster, right? So this, I want the listeners to understand, this was the primary objective behind the idea of flattening the curve, right? So in order to slow down and control the spread of the diseases so that the healthcare sector can catch up, right? Now, leaving the healthcare sector aside, what we need to understand is the idea is what happens after the curve has flattened, right? So while everyone agreed that economic lockdown specifically is something that can be done, you need to understand in a country like India, there's not India but developing countries, there is something specific known as transient employment, right? What does this mean? So transient employment simply means temporary employment. Like, these are people who often work very menial jobs and they don't have a sort of contractual basis of a working agreement that, okay, I will be paying you X amount of money for these days, right? The main idea of this transient employment is that in India, especially at the rural sector, especially at the baseline of India, this is the sort of employment that dominates. And when it comes to shutting down the economy, these are the sort of people who are the most widely affected, right? Now, why are these people so important? Well, you can look at them as simply someone who goes to, let's say a farmer, right? He can hire someone to maybe collect the crops, collect whatever sort of crops he has for a harvest season, or someone who's simply gone out to spray pesticide. These are jobs that are completely created on a very, very temporary basis. So understand the fact that when a majority of the jobs specifically in one sector of your economy is dependent on this sort of transient employment, when any government takes a complete shutdown for, let's say, 1 month, 2 months, or in our case has been around 2.5, 3 months, these the costs that exist are not simply the foregone costs of having lost that sort of employment for the person, but there are further increasing number of costs that are going to be incurred not just by the person who's lost a job, but also by the employer, right? Now, why exactly does this is this so important when you're looking, especially in the context of the debate, right? When you have something like festivities coming up, when you have Diwali or Durga Puja in certain parts of the country, these are also times when the economy sees a rather large boom in spending, right? Whether you have the electronic stores, automobile stores, any sector, these are often seen as points which have the largest spending potential. And for a government, specifically when it's trying to bring the economy from the brink of depression, this is something that the government has to be very, very mindful of, because the moment it's not mindful of that certain aspect, you failed in your job as a policymaker, as a protector of the lives of the people. So this is one very, very important factor that I think needs to be considered when we're trying to look at the idea of what a COVID peak is, or what happens after the end of the COVID, right? Okay, that's all. Thank you.
Thank you very, very much, Samir. Some great points there by you. Government policy is of prime importance, and indeed it is. Flattening the curve depends on strengthening the medical system. Transient employment is a necessity for a developing country like India. I would now request Hamid to go ahead with his opening statements. Thank you very much.
To begin with, I would definitely like to thank Samir for the points he's raised. Now, the fact remains that COVID in India has not reached its peak. The tolerance level of the people in India has reached its peak. Now, when I say this, it's because the people of India no longer want to stay at home. It is no longer possible for them or practical for them to stay at home, which is why they have become negligent towards COVID and are moving out, and in many cases not following the basic instructions of wearing masks and following social distancing norms. What has happened now in India today, if you have a very, very practical look at it, is that today itself more than 55,000 new cases were reported. Globally, there have been 42 million cases of coronavirus, out of which more than 7 million have been in India alone. And in the last 24 hours, about 55,000 new cases have been reported. Now, when you talk of a country like India, one of the first things that you need to realize is we are using the word reported here, a number of cases reported. So in a country like India, when we talk of number of cases reported, we also need to realize that there are a large number of cases which go unreported. And there have been various surveys by various media organizations that go on to say that the number of cases which are unreported in India are apparently going up because people are scared to come out and get themselves tested for the fear of quarantine, for the fear of some sort of social backlash that's going to be there. Because you need to understand the numbers in India do not speak the reality. With the number of cases that have been reported, we are already the we have already got the second largest number of coronavirus cases across the globe. With the number of cases which are reported, you need to understand that the problem that's happened in India today is the fact that there is some sort of social stigma attached to getting affected or infected with this coronavirus, which is why people are not coming out. So I would like to say that whenever you go by numbers, just go with a certain degree of caution, because you need to understand, if you look at the global phenomenon today, let's look at a country like UK. After enforcing a very, very strict lockdown, it was largely believed by UK that their problems are going to come to an end as far as coronavirus is concerned. But if you look at the latest numbers or the latest measure by the measures by the UK government, you will go on to see that they have actually gone on and reinforced some stricter norms again. And Boris Johnson has gone on record to say that a second lockdown might be necessary because there's a second surge in COVID. So we are here dealing with a pandemic which has never been seen before. It's not that there haven't been pandemics before. It's been that such a sort of a virus has not been there before, where there is a second wave that's coming in many countries, and there have been people who've largely gone on to say that a second wave in India is possible as well. Because right now there's a certainly the number of reported cases are going down, but like in other countries, there's a higher chance that the number of cases will go up again, because there'll be a second wave, let's say in January or February, as far as some experts are concerned. So what I'm trying to tell you today is that India is all set to go for a second wave because people have forgotten to exercise that caution. You go on to see that people are not wearing masks, they're not following social distancing. In Kerala, you had the Onam festival, and after the Onam festival, the number of cases has again gone up. So we are here going towards the festival season, and according to many experts, this is going to be the death knell as far as coronavirus cases in India are concerned. Now, when you look at the vaccine as well, you see, in India, we've been following the plasma therapy. We've been for giving medicines such as hydroxychloroquine and remdesivir and medicines like that. Okay, but the problem has happened is that the ICMR has just last week said that the plasma therapy is not a viable therapy for the coronavirus. So what we've been following, so on and so forth, as the Bible to treat the coronavirus has been junked by the ICMR. So we are essentially in a scenario where we don't even have a proper treatment to it. So when we don't even have a proper treatment to it, when there's no vaccine to it, how can you say the number of cases are going down? Because the people are now more lax. They are not following the requisite measures. They are going out. How can you say that the number of cases are going down and India has reached its peak? What we are essentially looking at is a far more dangerous scenario. Of course, you can see that the social backlash associated with the coronavirus has gone down, but that does not mean the number of people getting infected is gone. It's in fact going up every day, but people are hiding the cases, which is a very, very difficult scenario. Today, you've got the President of America who's been infected with coronavirus. You've got the Home Minister of India who's been infected with coronavirus. You've got half of the cabinet who's been infected with coronavirus. Every day, new cases are coming up, and herd immunity has not been achieved, right? Apart from that, you've got Bihar elections coming up where people are going to go up, and those are areas, rural areas, where people are not wearing masks, where they're not following social distancing measures. So you've got elections coming up. On top of that, you've got examinations coming up. On top of that, you've got UPSC examinations being held, IIT JEE examinations being held, and in many cases, it's been seen that social distancing norms, the basic norms, are being violated. In the light of this, how can you go on to say that the peak has been achieved? And if anyone is actually believing that, that's actually just a way to misguide the Indian people, is what I feel. When you talk of the lockdown, right? India had one of the strictest lockdowns, and the peak, or the so-called peak that you're talking about, was actually achieved after the lockdown was lifted. So which was the fact is that the lockdown in India totally failed, and now you cannot introduce a second lockdown, because the fact remains that if you introduce a second lockdown, the people are going to backlash against the government, which is why the government has been forced to open things up. So the government has not opened things up because it has reached its peak. It has opened things up because it can no longer sustain a lockdown. So people to say that India has reached its peak is dangerous, because things are opening up, more cases are going to come up, herd immunity has not been achieved, people are not following the requisite measures, we do not have a proper treatment yet. So to say that India has reached its peak is very, very dangerous, and people should not be misguided about it. Thank you.
Thank you very much, Samir. Hamid, those are some great points there by you. Tolerance in India has reached its peak and not COVID. Very interesting. 55,000 new cases have been reported in India in the last 24 hours. Large number of cases have not been reported, and the reason is fear. And I quite agree with that. UK may impose a second lockdown, no proper treatment, and no vaccine. Lockdown in India has failed. says Hamid. Samir, I would now request you to begin with your second round of rebuttals and refute. Take it away.
Nice points from my opposing speaker, but there are a couple of things that we have to keep in mind, right? So, because considering that we're dealing fundamentally, that the fact is that we're still dealing with policy, right? Whether it's for a hurricane, tsunami, pandemic, the idea is that it's all about policy, right? And how does policy work? The entire point of a policy is to weigh the costs versus the benefits of having that policy, right? Now, there are definitely huge question marks, especially regarding the vaccine, whether it's the Russian one, whether it's the US one, whether it's the UK one, right? But what the main idea that must exist is that the vaccine is still going to take time. It's still not at a stage where it's able to be mass produced and delivered to most people, right? So, what we need to understand is that the idea of a second wave or another secondary peak has always existed in any sort of pandemic that there has ever been, right? But the most important has been the way that the government deals with the second peak or said of a second wave, right? And when you're trying to look at the cost side of a lockdown policy, you need to understand that there are costs that often are not borne by directly the government or by people like us who live in, let's say, to lack of a better word, in India compared to those that live in the Bharat, right, the rural part of India. These costs are something that are so hidden, but yet are so extremely valuable to the people who live in rural India, right? Because when you try to take away their livelihood, when you try to take away the only source of income, it is something that contributes much worse than anything that a pandemic can do, right? I'd like to point out a very interesting report put out by the National Public Radio out in US, right? This was a report made specifically for the US, right? But keep in mind, this is a developing country, right? And the report stated that given what is going on in places outside of a New York, the cost for the cost economic costs of the lockdown have now begun to outweigh the economic cost of the pandemic of the virus itself, right? And look at the idea, look at where this happening. Right? This is happening in a nation that's so-called the top nation of our planet, right? And then try to think about how it translates into something like in India, right? India, where you have an entire economy, like you have, I believe the official numbers are to roughly 50 to 60% of the country lives in is technically works in sort of this transient employment, as I've called it, or to be more technologically correct, undocumented employment, right? These are employment that are not generated on a piece of paper, right? It's simply done on the basis of the word of mouth or the demand that exists, right? And now try to think about what happens when you've taken away their livelihood and when you've started to see that the costs, the said lockdown, which is supposed to be for their benefit, is actually going against it, right? This is another part of when it comes to government policy, right? When we look at government policy, it's often misguided to just sit and look at what the intentions are, right? We can all agree that all government policies have said really, really good intentions, right? Like the lockdown, for example, the intention was to save people's life, right? But when we're trying to measure how effective a policy has been, the main metric of this measurement should be the effect it has had on the people, right? Which is why I brought up the idea of Sweden before, right? Even UK, a country which vehemently opposed the lockdown rules in Sweden, had to turn around and say, okay, look, they have achieved something that we could not have, right? And this is something that I think is far more important, and that is what needs to be considered when it comes to what a lockdown can and cannot do for its people, right? So, in order to sum up, I would simply say that the peak, the epidemiology of any pandemic will always have these certain first wave, second wave, third wave, right? But what matters is how effective the policy is at not only just combating the wave, and also trying to determine how useful it is for the lowest rung of the society, right? Yeah, thank you.
Thank you very much, Samir. Those are very thought out points. You have very well thought out about it. Second peak is inevitable in any pandemic, and indeed it is. And we have seen, in the past, if you take the Spanish flu and everything that you put the example of that, the second peak is inevitable. Transient employment key to successfully come out of pandemic, and I believe in that as well. Hamid, I would now request you to go ahead with your round of rebuttals and refute. Thank you.
Firstly, I would again like to thank Samir for his speech. If you come to think of it, I am, to be honest, very amused by what Samir has to say, because he's going on to talk about the cost versus benefits of policy. He's talking about economic cost versus economic benefit when we are essentially dealing with a public health crisis. When you talk of policy, let me tell you what India's policy has been. Global leaders have criticized India for firstly too strict a lockdown, and secondly for implementing a lockdown at the same time. There is a view that had Narendra Modi stopped the entry of international aircrafts on January 30th, probably the pandemic would never have come in India in such a large pace as well. So that's for policy. Second is the economic package that Narendra Modi has given for Atmanirbhar Bharat. There has been a lot of criticism in the way in which it is going to be implemented. There's been a lot of criticism in the policy itself. So if you come to think of policy, that's a whole new debate altogether. What the scope of today's debate is that, has the public health emergency gone away? Has India reached its peak as far as the public health emergency is concerned? And the simple answer to that is no, right? Because the fact remains that the number of cases in India is going down from compared to this curve in this wave, but there will be a second wave, which Samir himself agrees. So if there is going to be a second wave in a pandemic, how can you say that the number of cases in India has reached a peak? Those are two fundamentally contradictory arguments, right? He's going to talk about some policy, some report that was implemented in the United States of America that talked about economic costs, economic benefits. The point is, you're looking at that from an economic point of view. That's my exact point, that the tolerance level of the people of India has reached its peak. The pandemic in India has not reached its peak. The public health crisis is growing day by day. Today, you're going to have more and more people who are going to be infected because the sectors are opening up. You're going to have more and more people infected because there are festivals coming up. You're going to have more and more people affected because there are elections going up. The fact remains that India as a country has to move forward, and the people have to learn to live with COVID. But the fact remains that the way the country is being governed and policy that Samir talks about, I would just like to quote what Joe Biden debate, that the people have not learned to live with coronavirus, they've learned to die with coronavirus. That is how the policy in India is being implemented day in and day out. Because you've got a lockdown which is too strict in the first place. It was opened up at the wrong time. Okay, you had a lockdown at the wrong point of time, because had international flights been stopped in January, you wouldn't have been having so many incoming cases into India in the first place. Then you locked down the country when the number of cases was still low, and then you opened up the country when the number of cases were going up. So you got a lockdown which was, firstly, you flattened the wrong curve. You've not flattened the curve as far as the number of cases is concerned. You flattened the curve as far as the economy of India is concerned, because India has now gone into a recession because of a wrongly implemented policy. So I don't know what policy argument Samir is trying to come up with, because you had a minus 23.9% contraction in that quarter. Now you're going to have about minus 7% in this quarter. So where is the economics? Where is the policy implementation? Where is the cost versus the benefit that you're talking about? So you've actually ended up flattening the wrong curve. Instead of flattening up the public health emergency curve, we've actually flattened up the economic curve of India. So we're having a recession. We've got people who don't have jobs. We've got people who are committing suicide. We've got children who can't go to school. We've got shortage in the number of beds, and you've got cases rising day in day out because you've got festivals. But the problem is that the current ruling party in India is going around on communal lines, wherein because of which state governments are not able to impose restrictions on festivals. Because if state governments impose restrictions on festival, you have the ruling party of India going on and creating trouble on communal lines, wherein people are divided in a communal electorate, right? So you've got communalism, you've got unemployment, you've got lack of education, you've got projects which are moving forward. You've got an Atmanirbhar Bharat package which apparently doesn't have the power to bring the economy back on track. You've got cases where I think 55,000 new cases 7 months into a pandemic. So after the lockdown, after you're seeing that the peak is gone, afterwards Samir says the peak is gone, and then on top of all of that, Samir comes and agrees that the epidemiology of a pandemic states that you'll have a second and a third curve. So you're going to have a second and a third curve. How can you say that India has reached its peak? This is simply misguiding the people of India. Thank you.
Thank you very much, Hamid. Great points, and I quite love them. Public health crisis is growing every day. The lockdown was implemented and lifted at wrong times, and I feel that strongly as well. I would now request Samir to go ahead.
Yeah, so the very, very strongly worded speech from Hamid's side, but I think Hamid also is a bit confused about what exactly I've been speaking about so far. So I'll just sum my entire portion up then quickly. My main point is that it's very obvious that the lockdown has failed, which is exactly the point that even I've stated, is the fact that this lockdown was implemented really, really disastrously. It should have been looked upon, scrutinized much harder before its implementation. And the fact is that this implementation has failed, right? Now, when we are trying to look up, but the spirit of the debate looks at the peak of the COVID cases, right? At the peak and what happens after the peak is passed. What I am simply saying is that once the peak, which has supposedly passed, you will always have a second wave or a third wave. But those waves do not mean the peak. I think Mr. Hamid is clearly lacking in his mathematical definitions there, but that I can't blame him for that. So what I'm simply stating is that the fact is that these peaks will continue, but what matters is how the government guides or helps the people navigate these peaks, right? That is the most important fact. And in that case, I do agree with Mr. Ahmed that the lockdown has been an absolute disaster, which is why I'm advocating for the lockdown and the restrictions to be lifted, right? Because when he talks about a public health crisis, is saying that it's unrelated to an economic cost and economic benefit. Again, I'd request him to go and have a look at what economics he has studied so far, because I don't think he studied that much by looking at that statement. But these things are often very, very deeply intertwined. And the fact is that when you often look at a public health crisis, you need to understand that it's not something you can look at in isolation, right? You can't just say that, let's say, oh, influenza is a disease, and therefore this is only a public health crisis, and there is like that is all that matters. The healthcare and the wellness of the people is all that matters, right? There are several other key aspects which are including the economic aspect, which can have further ramifications even after the influence has died down, right? So I think this is all that I'd like to say, and yeah, thank you for having me on. It's been a pleasure.
Right. So it was something very rare to see one debater agreeing with another. And yes, I would now request Hamid to go ahead with his closing statements, please. Thank you.
You see, I am a little confused with what Sameer is trying to do here, because he agrees that the lockdown was a disaster. He agrees that there will be a second wave and a third wave and a fourth wave. So my entire point is, if the lockdown has been a disaster, if the economy is collapsing, if there's going to be a second and a third and a fourth wave, how can you say that India has reached the peak of its COVID crisis? India has not reached its peak. The point is, we still do not know which way this pandemic is going to go. And the point remains that the people of India, because of people like Sameer who are misguiding them as far as this COVID crisis is concerned, because right now you think it's better to talk about Sushant Singh Rajput and all of this rather than talk about the crisis at hand. The people of India have been misguided by people like Sameer. And now what's happened is that they've decided to loosen the screws. They will not wear masks. They will not follow social distancing. The administration has forgotten that COVID exists at all. What you need right now is to understand that the crisis is going to get more and more grave if we continue to lower our guard the way we are. You have got the Prime Minister of India continuously giving a message to wear a mask. He's not shaving his own beard to tell the people that is dangerous right now. So what you need right now is for the administration to tighten the screws, for the police to be active and to notice people day in and day out, to carry out more awareness campaigns, to distribute more masks, to ensure that there are more social distancing measures followed, to ensure that schools continue in the online method, to ensure that there are more innovative methods of education, to ensure that we have more beds, to ensure we have got more innovative methods of employment for the people, and not to misguide the people like Sameer has done today. He's agreed that the lockdown is a failure. He's agreed that there'll be a second and a third and a fourth wave. He's agreed that the policy leave a lot to be desired for, and still he says that India has reached its peak. So therefore, I want to say, in conclusion, that India has not reached its peak. The crisis will get more grave if people do not understand that this is going to turn more dangerous. We need more awareness, more education, and more innovation. Thank you.
Fantastic, fantastic, Hamid. Well, ladies and gentlemen, what we saw here was a fantastic debate between two fantastic debaters, Sameer and Hamid. With that, we come to the close of Rebuttl. Thank you, Sameer and Hamid, for joining us. It was a pleasure to hear you on Rebuttl. Our listeners can participate in the debate on our website or via the Extra Insights app. We would love to hear your rebuttals. We shall see you next week with another real debate. Thank you very much.